Assalamualaikum and salam sejahtera. First of all, we would like to thank you to the organizer for accepting our concept paper to participate in international conference on trends in technology, business, education and social research. Our concept paper, namely e-cigarettes and dilemma of nicotine regulation in Malaysia. We have four of us, led by Encik Zulkarnain Mazlan, senior lecturer from Faculty Communication and Media Studies from UITM Shah Alam campus. Myself, Asma Md, Puan Munirah Muhammad Noor, and last but not least, Cik Nurul Murni Aisyah Jaafar. Okay, this is a concept paper. Okay, before we start, this is the agenda for today. First, of course, introduction. Second, problem statement and research gap. Thirdly is pathetic dot theory. We're going to employ pathetic dot theory for this research. And then from literature review and theory, we come up with the research concept in order to come up with the conceptual framework. Last but not least is conclusion. Let me start with the about the e-cigarettes or e-cig have penetrated Malaysian markets in 2013 as an alternative to conventional cigarettes. Based on previous studies shows that e-cigarettes are popular among adolescents and teenagers due to the role of media successfully at shape and promoting e-cigarette is less harmful than smoking for their health. Second reason is cigarettes have a lower cost per use as compared to traditional cigarettes. And lastly, both adults and adolescents strongly believe that by shifting from traditional cigarettes to e-cigarettes, is able to get rid from the bad smell smoke. Sorry. However, there is no scientific studies has proven that e-cigarettes that contain nicotine is able to help smokers to stop smoking. The reason being is that nicotine is highly addictive and found in most of e-cigarettes. Both tobacco products and e-cigarettes pose a risk to health, and safest approach is not to consume e-cigarettes either. Many medical doctors and Ministry of Health raised their concern about the increased use of e-cigarettes, especially among adolescents. The reason for this is that there are negative effects from using e-cigarettes that are similar to those from conventional e-cigarettes that contain tobacco and nicotine. This is according to Chan and Harun 2017. E-cigarettes and nicotine can cause a serious health implication that it can increase the risk of someone getting various disease. In fact, that e-cigarette user has higher risk of getting cancer, germ infection, lung cancer, head of neck problem, leukemia, and stomach. It is all the health risk is similar like if the user of e-cigarettes consume tobacco or any other traditional cigarettes. This is a problem statement and research gap based on data published by Malaysian Ministry of Health. It is reported that 15.6% of teenagers aged 15 to 19 in Malaysia use tobacco products, including e-cigarettes. And then, in fact, according to Hellstrom, e-cigarettes has been designed to duplicate the traditional cigarettes and should be help the traditional smoker to quit smoking. However, there is no proof or scientific proof that can support the finding that e-cigarettes actually can help smoker to quit smoking. This is according to Chan and Harun. However, Recently, Minister of Health, Dr. Zaliha Mustafa, she has presented in Parliament stating that nicotine, including tobacco, patches, chewing gum, nicotine liquid, and nicotine gel is now exempted from the Poison Act 1952. However, the exemption in the Poison Act 1952 has created a polemic among the public and medical practitioner and also business sector. In more clear context that Malaysia is now in a dilemma about whether to introduce law to curb the danger of using e-cigarettes from a health or generate economy from the e-cigarette business. Okay, this is the research gap. Based on our finding from the past study, only few research published only cover the intervention and design of e-cigarette to prevent the initiation and escalation of e-cigarettes. And there also studies on if negative effect of e-cigarettes on to the university students and ban on the use of e-cigarette in university campuses. And then we discover that only little, almost none study on e-cigarette they have available in Malaysia to gauge public opinion on e-cigarettes law. Due to that, our group has discussed and agreed to use quantitative theory to gauge public opinion if a bill regulating the use of sale and the use and sale of e-cigarettes is introduced in Malaysia. This theory was introduced by Lawrence Lessig in 1998 via his article and later in his book entitled Code and Other Laws of Cyberspace, published in 1999, which is more geared toward to socio-economic regulation. According to Lessig, humans are governed by four forces, namely technology, law, economic, and social norms. This is according to Lessig. Thus, this paper justified that use of this theory because of the dilemma phenomenon faced in Malaysia pertaining to the e-cigarettes problem, in line with Lessig's opinion that all individuals are governed by four forces: technology, law, economy, and social norms. Thus, we cannot ignore the four factors mentioned above in determining the direction of the rules and regulation of e-cigarettes in Malaysia. Okay, based on the Lessig theory, we come up with the four attributes, namely technology, economy, law, and social norm. For technology, in general, the purpose of technology is to meet a human need in order to solve a human problem. Thus, e-cigarettes are a new type of cigarette that is expected to minimize a negative effect and negative impact to the traditional cigarette, especially that to get rid from the bad smell and of course as an option, an alternative to the smoker to quit smoking. From the economy aspect, cigarettes and tobacco products are able to generate income and boost the economy in terms of tax collection from business sector and manufacturer. And of course, from the economy, it will create a new job opportunity, further spur the downstream and upstream industry, especially from manufacturer, distributor, and also retailer that sell the e-cigarettes device and liquid. However, it has a downside, which is a cost of treatment and also will be burden to the people and the country. In terms of law, only through law the potential risk due to smoking can be curbed, especially to protect the minor and adolescent and also the high-risk groups such as pregnant lady and also senior citizen. And through the law that actually if the law is implemented, on the reseller or retailer cannot sell the device and also liquid to the minor or adolescent or below age of 18. And Then through the law also, perhaps that the government gazetted certain building and public area that prohibited and to disallow the smoker to smoke at that particular area. This is a collaboration between the PBT and also Ministry of Health. Last but not least, which is final attribute for this research concept is the norm, social norm. Norm is defined as a measure to determine something, which also means a rule or provision that has become a daily routine that is expected to be followed by every member of society. According to LASIK, social norm is actually law, prescribed behavior that can be done to avoid legal punishment, especially punishment from the community. And then, in fact, that in Islam, also this is part of social norm. Smoking is prohibited in Islam. In fact, at certain state, especially in Selangor, smoking is considered as haram. And also, this is also part of social norm. When women are smoking, including traditional cigarette or e-cigarettes, smoking to the eyes of public or or community, a woman is smoking is considered as unpleasant manner or reflect a bad behavior. Based on the literature review and theory, this study proposed the conceptual framework as follows, which is comprises of technology, market economy, law, and norms, which is these four factors may shape the regulation of e-cigarettes in Malaysia, and thus we will further develop the item in order for us to proceed with the questionnaire. So these four construct technology, market economy, law, and norms. We will develop the item or adapt and adopt the item based on previous study to obtain the public opinion in Malaysia on regulation of e-cigarettes in Malaysia. With that, thank you for your time and thank you for watching.